Hello, good evening. My name is Bisola Adeniran. I'm one of the students at United States University. I'm taking nursing 572 right now, and I'm here this evening to complete assessment on my patients, and I'll be doing the cardiovascular assessment and peripheral assessment today. So, hello, how are you?
I'm good. How are you?
Good, 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 good. How old are you?
I'm 19 years old.
19. Can you please tell me your name one more time?
My name is Sam.
Your name is Sam. And just to let you know that I'll be doing your cardiovascular assessment today and also your peripheral assessment. Do you give us a consent to perform this assessment on you today?
Yes, I do.
And just to let you know that you are being recorded as well. Did you give us permission to record you for teaching purposes?
Yes, I do.
Yes, okay. Consent taken from my patient. And first, before I start, I'm going to wash my hands, okay? Okay, hands washed. My hands are washed, and the first thing I'm gonna do is to check your blood pressure in the supine position. Supine position means that you are laying down in bed. So I'll be checking your blood pressure on both hands, and also I will be checking your blood pressure also sitting up, okay, during this assessment. And I have my stethoscope to listen to your systolic blood pressure and also to your diastolic blood pressure. Okay, your systolic blood pressure is the top number of your blood pressure, while the diastolic blood pressure is the lower number of your blood pressure. Okay. Awesome. Your blood pressure reads 110/60. And I'm going to go on the other side also to do your blood pressure, okay? So I'm doing your left arm blood pressure, okay? So I have the cuff wrap around your arm, which will be doing the reading for us today. Your blood pressure on the left arm reads 108/62, which is not much of difference. Okay, now I want you to sit up. I need you to sit up in bed. Okay, so I need you to sit up straight. Okay, so I'll be checking your blood pressure while you are sitting up. Okay, your blood pressure reading while you are sitting up on your left arm is 110/60, which is not much difference. It's a normal reading. It's a normal reading for you, okay? And also I'm gonna come back and check your right arm while you are sitting up, the blood pressure, okay? And the reason for doing this is to make sure that there's not much difference, or there's no drop, while you are sitting up and when you are lying down in bed, okay? Your blood pressure on the right arm while you are sitting up is 108/64, which there's not much of a drop in your blood pressure. Okay, so now that we are done with the blood pressure, now I'm going to be assessing your jugular vein pressure. Okay, and while doing this, I need you to be sitting in 30 degrees to 45 degrees angle. So I'm going to position you. Okay, can you okay, so this is 45-degree angle, and I'm going to ask you to turn to the left side. No, not your whole body, your neck, because I'll be looking for your jugular vein. Okay, just relax. Okay, so I can see your jugular vein right here. So I'm going to measure it at 30-degree angle, and I'm gonna need a depressant that will measure where the point is, and then I'll put a measuring ruler. Okay, and I'm going to measure it, and I'm gonna see where it meets. It's right here, which I've marked it, and I'm going to measure it with my tape measurement, and I can measure 2 centimeters, so which is normal. Anything lower than 3 centimeters is normal, so that is a normal reading. Okay, so your JVP, it's normal, and it is 2 centimeters. Okay, now I'm going to move on to palpating your carotid pulse. Okay, and when I want to palpate your carotid pulse, I'm going to look around your neck, which is close to your trachea area. So I can palpate it, which is 2+. I can feel it on your right side, and also I will turn you to the left side, which I'm also palpating your carotid pulse, which is 2+, which is a normal finding. And that is done. So now that I've palpated, I'm going to now auscultate the carotid pulse. Okay, I'm going to use my diaphragm, and also I'll be using my bell, the bell of my stethoscope. As I'm listening to the carotid pulse, I want to listen for bruits, and I'm checking the left side as well. I'm checking for bruits, and there's no bruit. I did not hear bruit, I just hear swish sound. And I'm going to use the bell side also to listen. I'm checking also on the left side, and there is no bruit. And when I palpate the carotid pulse earlier, there is no trill. Okay, it's normal, and the pulse is 2+, as I said. Okay, so now I'm going to look at my patient's chest wall, and when I'm looking at the chest wall, I'm looking at the rise and fall of the chest wall. I want to make sure that my patient is not breathing with his accessory muscles. I want to make sure that my patient is not in any distress. And as I'm looking at the chest wall, is rising at the same time and is also falling at the same time. I'm looking for discoloration, which there's no discoloration at this point. I'm also looking for any lesion, any scars, any surgery scars and all that, which I did not see any scar on my patient. So now, after inspecting, I'm going to palpate. my patient's chest wall. And when I mean that I'm going to palpate on the right upper second intercostal, right here is the aortic. Okay, so I'm gonna palpate the aortic, and then when I go to the left second intercostal space here, I'm going to be palpating the pulmonic. Okay, and on the third intercostal space here is the hep sign, hep point, and on the fourth intercostal space on the left side, right here is the tricuspid valve. And at the mid clavicular line, which is the PMI point here, I will be palpating the mitral valve, which it's palpable and it's normal. And also I will look at my patient's abdominal aortic point as well, and which I will find at the mid section right above the by the belly button, which is the navel. So I'm gonna be looking for the aortic, abdominal aortic, which I'm able to palpate it also. And when I also inspect earlier, I was able to see the pulsation of the abdominal aortic. So everything looks normal. So now that I've checked my patient's, I've palpated my patient's chest wall, now I'm going to auscultate. I'm going to auscultate my patient's chest wall, and I'm going to be auscultating with my diaphragm, and also I'll be auscultating with the bell of my stethoscope. So now I'm going to be listening to your heart, okay? Okay, so on your right second intercostal space, I'm listening to your aorta, which I'm able to hear the S2 sound right there. And also when I move to the left second intercostal space, I'm listening to the pulmonic, which also I can hear the S2 sound right there. And on the third intercostal space, I can listen to the EP sound, EP point. So as I'm listening, and also I move my diaphragm down to the fourth intercostal space, where I listen to the tricuspid valve. And when I move it down to the mid clavicular line, on the fifth intercostal space, I'm listening to the mitral valve, which is the S1 sound. When I listen at the mitral valve and also the tricuspid valve, I'll be listening to the S1 sound, which are the normal sound, and I can hear everything is normal. Okay, so now I'm going to move on to my patient, I'm going to I'm sorry, my hairbuds. I'm going to auscultate. Oh, okay, sorry, I found it. Okay. All right. So now that I've just listened, auscultate my patient's aorta, and also the. So I'm checking on the S1 S2 sound on my patient, and for me to check the S1 S2, I need to listen to my patient's right second intercostal space, which will be the aorta. That will be the S2 sound, which is a normal sound. And on the left side, which is the second intercostal space, I'll be listening with my diaphragm, I'll be listening to the pulmonic, which is S2 sound, which is a normal sound. And on the third intercostal space with my diaphragm as well, I'm listening to the hertz sound. And moving to the fourth intercostal space, which will be the tricuspid valve, which is the S1 sound. And at the mid-clavicular line, which is the mitral valve, I'll be checking the mitral valve on the sixth intercostal space. On the fifth intercostal space, which is S1 sound, which is normal. And also, I'll be listening to my patient abdominal aorta with my diaphragm. I did not hear any bruits, and which is normal. And palpating the aorta also, I did not feel any trill. And the pulse is 2+, which is normal. And I'm going to be also listening with my bell, my stethoscope bell. I'm coming to the right side, which is the aorta. I'm listening. And I'm also moving to the left side, second intercostal space, which I'm listening to the pulmonic. I'm moving to the third intercostal space, which I'm listening to the ep. And I'm moving to fourth intercostal space, which I'm listening to the tricuspid valve. And when I come to the mid-clavicular line, I'll be listening to the mitral valve sound, which is the S1 sound, and which is normal. I can hear that. And also, I'm listening to the abdominal aorta, also with my bells of my stethoscope, which is also normal 2+. So I am done with that assessment. So as you can see, I was able to inspect first, then I was able to palpate, and I auscultate my patient's lungs. So now I'm going to also look for the femoral pulse of my patient, which I'm going to also auscultate the femoral. And I'm going to be giving my patient a privacy here. So I'll be checking the femoral pulse. I cannot feel any trill, and it's 2+, which is normal on the right side. And also on the left femoral, also I'm checking it. It is 2+, and there's no trill, which is normal. Okay. So now I'm going to auscultate my patient's femoral pulse. So I'm going to go to the right femoral pulse with my diaphragm, which I'm auscultating. There is no bruits, which is normal. And I'm also going to the left femoral pulse. I'm auscultating, listening to it. There is no bruits, which is normal. And now that I'm done with that, I'm also going to go ahead and do the peripheral exam on my patient. So I need you to bring out your arms for me. And what am I doing when I'm looking at the upper extremity, the arms? I'm checking for discoloration. I'm checking for any lesion. I'm checking for edema. I'm checking for any redness, any tremor. And I can see that my patient has no tremor. There's no discoloration. There's no edema noted. And I'm also checking the nail bells for clubbings. If there's any clubbing, there's no clubbing. The nails looks healthy. And also, I'm going to check for capillary refill on my patient. I will check for the capillary refill on each finger, which it is lesser than 2 seconds, which is normal on the right arm. I'm checking the left arm as well. So it is lesser than 2 seconds, which is normal. So that is normal finding. You can put your arms down. So now I'm going to check before I move to the lower extremities, I'm going to check for the radial pulse of my patient, which I'll be checking on the wrist area. The pulse is regular and it is 2+. And I'm going to also check your left radial pulse. It is regular and it is 2+. And now I'm going to check the brachial pulse on the right arm. The radial pulse is present, regular, and it is 2+. I'm also checking the left side radial pulse. It is present, it is 2+, and it's a regular pulse. So the upper extremities pulses are done. So now I'm moving to the lower extremity. And when I'm checking the lower extremity, what I'm checking for on my patient's lower extremity, I'll first inspect the skin color. I'll be looking at the skin color to see if there's any discoloration, or if there's any edema, or if there's any lesion, or if there's any nodule. But as I look at my patient's lower extremity, I see no edema. The skin looks moist, and there's no nail clumping, and there's no discoloration. And now that I've established that through my inspection, I want to palpate. And when I palpate, I want to check my patient's pulses on the lower extremity. The first one, it will be the popliteal, which is at the back of the knee. So I'm going to check the popliteal pulse. It is present, which is 2+. And I'm checking the left side as well. It's bilaterally present and it is 2+. And now I'm going to move on to I'm going to check the posterior tibia pulse, which is behind the ankle area. I'm checking the right side. It is present, +2, and it is regular on right side. And on the left side, I'm checking now. It is regular, it is present there, and it's 2+. So bilaterally, it is present and 2+, which is normal finding. So now I'm going to check on the dorsally-pedis pulse, which is on the foot. So I'm checking the right side. It is present, it is 2+, which is normal finding. I'm checking the left side, the dorsally-pedis pulse. It is present, it is 2+, and it is regular bilaterally. So all these findings are normal findings for my patients. And I'm going to ask my patient, can you lift your leg up for me? Okay, can you put it down? Awesome. All right, so I'm going to cover my patient up. So, and while I was inspecting my patient, also the lower extremity, I was able to check for the clubbings of toenails, which he has none. There's no clubbing of toenails. And when I checked it also, there's no lesion, there's no hemorrhage, there's no discoloration. So the capillary refill on the toenails are also lesser than 2 seconds. which is normal finding. Okay, so all the capillary refill on each toes are lesser than 2 seconds, which those are normal findings. And during our cardiovascular and peripheral assessment today, every assessment that we have done on you, it's a normal finding. You are healthy. So your next visit will be in 4 weeks time. All right, thank you.
Thank you so much.